rebuttals first. The first speaker, the opposition told us that who enforces this moral ethics on doctors? When we say that before you become a doctor, you take your vow, and this is what that enforces the moral ethics the doctor should follow. And if you're so strong about your religious views, that you're so strong that if I'm a Catholic, I wouldn't do this, why do you choose to become a doctor in the first place? If you choose to become a doctor, no thank you, and out of order. No, if you choose to become a doctor, you are supposed to abide to everything a doctor should do, even if it means that it goes against your religion, because do not mix profession with religion, ladies and gentlemen. And one should always remember and heed that profession should not mix with religion, because it's two separate things and it does not gel together. And the person should remember that the person should not choose a profession that he or she has to go through, something that puts them in a very bad situation, that they have to go through, have to go against their personal beliefs and their religious beliefs. No, thank you. Sit down. Now, moving on to my case. No, thank you. Like what my first speaker has said, medicine is science, and science and religion does not mix together. Why? Because medicine, which is science, this is hard facts, and religion consists of personal beliefs. You do not mix personal beliefs in your profession. You do not mix personal beliefs with science. And one wishes to practice science or medicine when you've gone through 5 years of studying hard to become a doctor, and you just come and say, I won't do this because I'm a Catholic and this is against my religion, I won't do it. But why did you choose? No, thank you. Why did you choose to become a doctor in the first place? When you're a doctor, what is your job as a doctor? You're there to save lives. Right, ladies and gentlemen? Doctors should all go out to save lives. No, thank you. And it's unethical to mix religion and medicine, like I said before. Why? Because it's harmful to the patient. No, thank you. It will adversely affect the patient, and it will also affect the growth of medicine, because you're not allowing any place for improvement. Like I said, it will hamper the progress of science, of medicine. And medicine, is ultimately, no thank you. Medicine is ultimately the science of saving lives. And doctors, no,
saving lives, madam.
No, thank you. You're out of order as long for 2 seconds. And doctors have duties to save lives. And when it comes to religion, when you talk about religion, that religion puts you on hold to save a life. Is that ethical? Is that right? Should a doctor think twice before saving life? This woman is struggling here. Should I think, okay, I'm a Catholic, should I save her life or not? No, that is not way. No, thank you. That is not how it's supposed to be done. Whether you're a Catholic or not, your job is to save life. Whether it goes against your religion or not, your job is to save life. Your profession there is to save lives, and no thank you. Your profession there is to save lives. So you might as well do it. And no doctor should, no thank you, please, both of you. Do not deny a patient a procedure that can save his or her life just because it doesn't agree with your religion. And if these doctors do not mix religion and science together, what will be the benefits? Lives will be saved. Of course, the patients will not be denied the procedures they'll be getting, and the doctors will be willing to take more radical decisions. So thank you. And the betterment of and improvement of such procedures will lead to improvement in science and technology. And it's also, moving on to my point, it is not fair for the other doctors that just because this certain doctor is very religious, is not willing to take this procedure, it gets pushed away to the other doctors who might not be as good as the other doctor, and who might not be as good as the doctor, who might not want to perform, but they have to because the other doctor is not willing to. No, thank you. Or is not as capable as the doctor who rejected the procedure, because the doctor who rejected the procedure, he is against his or her religion. Like we said, all doctors should be able to perform all procedures, whether or not from your any religion. No, thank you. And it's also not fair to the patient, because the patient has the right to choose which doctor they want the procedure to be done. If the patient chooses that I want Dr. Lee to do my procedure, and Dr. Lee is a Catholic and he wouldn't do that. No, thank you. And Dr. Lee wouldn't want to do that. Why? And this patient is denied of a choice of the doctor he or she wants, and the patient does not have a capacity to choose which doctor, and this undermines the patient's comfortability level with the new doctor. So when when religion is seen, it should not be mentioned when you're taking a profession as a doctor. Like we said then and again, a doctor is there to save lives. He should not get confused with religion as undermining his profession. No, thank you. Yes, sorry.
Madam, could you please show me the link between saving lives and abortion and euthanasia? A clear link.
Well, you deny this woman of the treatment for abortion. Ultimately, most probably, she might lose her life. She might lose her life because of loss of blood. And the treatment, when the treatment is not right, there are chances of people losing life. And I did not mention anything about euthanasia. And what have we put forth to you today? That medicine is science, and science is considered as hard facts, and you do not mix hard facts with religion, which is one's personal belief. And one personal belief should not reflect in their role as a doctor or in their profession. And that the doctor's aim and the doctor's job is to save lives, and it's unethical to mix religion and medicine. And it's not fair for the other doctors who might not be as capable as this doctor who's there to perform the procedure. And it also doesn't give the patient the capacity to choose the doctor they want. They now have to see between, is this doctor religiously equipped to do my procedure? Is he willing to do my procedure? So ladies and gentlemen, please go with the proposition of this case. Thank you very much.